Hello and welcome to Bulimia Sucks. Now, I'm your host, Kate Hudson Hall, and thank you so much for listening. Now, this is a platform for people to share relatable, uplifting, and inspiring conversations based on an eating disorder. And episodes include talking to people struggling now with their eating disorder, sharing their personal stories and their difficult journeys, but their steps taken into their recovery and how they've done that. And then also to other people that have overcome eating disorders and to professionals that maybe haven't had an eating disorder, but work with people with eating disorders. Now, I am very excited because my book, Anxiety Hacks, is out and it is on Amazon. And the subtitle is Techniques, Tools and Tips to Calmness. So it's very exciting because I teach the techniques and all of these different tools and loads of different tips that I have taught to thousands of my clients over the years. So it's taking you from being constantly riddled with explosive anxiety to immediately feeling calm and relaxed. Because there's some amazing techniques in there that people should be using to be able to really break those anxiety patterns. And there's just such a multiple variety of different ways that you can do that. So check out my book if you put Anxiety Hacks into Amazon and you'll be able to find it. So have a look. Now, our fantastic guest today, I say it, I'm very excited, is Dr. Megan Wilhite. Now, Megan is a licensed clinical psychologist who's a certified eating disorder specialist and supervisor from the International Association of Eating Disorder Professionals. Now, she was originally from Melbourne, Australia, and moved to the US to play basketball before returning home to continue her basketball career. And then in 2010, she relocated to LA, where she earned a doctorate in clinical psychologist from, is it Alliant International?
Yeah.
Alliant International University. Megan now lives in Denver, where she runs Acacia Healing and serves adults, adolescents, children, and their families in their recovery journey. We want to hear how you do that, Megan. Thank you so much for joining us.
Thank you for having me. I'm excited to be here.
Oh, gosh, yes. So how long have you been practicing?
Oh, goodness. Probably, well, I started graduate school in around 2010. So what is that? Oh my goodness.
So it's 12 years ago.
Yeah, about 12 years.
Wow, that's a long time with a lot of knowledge. We want to hear it all, please. So now where should we begin? So let's start at the beginning. So a question I do like to ask is, so if somebody is thinking about taking that step onto the first rung of their recovery ladder, what would you say to them that may guide them towards taking that first step, Megan?
I mean, depending what that first step is, I think that obviously, finding a good treatment team or realizing that you're not alone in the struggle with an eating disorder, right? That many people struggle, and that there is help. I think that a lot of times people really struggle with eating disorders in private, right? Eating disorders really grow power in secrecy, and so being able to reach out, whether if it's not to a therapist at the beginning, right, because I know that can be really intimidating too, that's a big step, but to a parent, a loved one, a partner, a friend, to be able to kind of share and be vulnerable with someone, and make a little bit of space that's not just you and the eating disorder, where you can kind of now share share some of that with somebody, I think that that can be a really good first step, because I know there's a lot of shame and anxiety with, saying that even aloud, even before you step into the therapy room.
Yeah. Yeah, I think that's a really important point, isn't it? It's just taking that small step and talking to somebody that you truly trust to begin to break that pattern.
Yeah. And, as I'm even saying that, I think that even that can feel like an enormous, and it is an enormous step. But yeah, so even to just start also kind of looking into and getting information on, right, podcasts, books, resources in the community where you can start to learn about maybe what you're struggling with, even before that step, right, that sometimes that might feel a little less threatening, a little less overwhelming, to just start kind of empowering yourself and educating yourself on kind of what's going on.
Yeah, no, that's excellent. And so if somebody came to see you and they had decided, this is their first sort of port of call, how would you take that forward?
Well, I think first, when anyone reaches out to me, I mean, one of the most, if not the most important parts to success in treatment is finding a therapist that you really mesh with and you really trust and connect with. And I think therapist shopping can be really exhausting and really hard and intimidating, right? Where do I start? How do I connect? What questions am I allowed to ask? And so to be able to kind of answer questions people have about the way that I work, about what kind of treatment for an eating disorder actually looks like and what would be kind of part of that journey, that those are the questions that you're allowed to ask when you're looking for a therapist, right? What's your style? How do you work? So I think that feeling, again, empowered and confident to ask those questions and find what works for you in therapy is a very good start. I think once that happens, one of the things that I really like to challenge my folks to do is to start just being a little bit more aware of their environment. Kind of, what are you consuming? And what I mean by that is not food, but emotionally, on social media. What am I surrounded with, friends, family? What is the environment that I'm in that maybe is reinforcing some of these, beliefs or behaviors, or this drive to change my body, or, whatever it might be, that I think that can be a really eye-opening thing to see how immersed we all are kind of in diet culture and disordered behaviors. It's celebrated in our society. And I think just taking that moment to say, okay, well, what's actually around me and what is helpful? And then what is actually harmful? So what can I start to move away from? And then what do I need to lean a little bit more into in my environment? Because it's a challenging process. You're going to need support and you don't need additional barriers. And I get the fantasy that wouldn't it be lovely if we could just kind of snap our fingers and, be immune to the society and diet culture that we live in. That's not realistic, but I think being aware of that is really, really important.
Yeah, and I think that's an excellent point, because so many people are in a trance with their eating disorder. They're in their off in a sort of another world, whatever you like to call it, and by asking that, asking yourself, well, hang on, what else? What is working here and what isn't working? There's probably a long list of things that aren't working, and it's maybe by writing it down will make it so much more conscious.
Right. I mean, even this awareness of, we grow up in, if I use the example of family culture, right, that maybe you're in a family that has, been aligned with diet culture too. And that's just what you know. And so starting to observe that and like, oh, wow, my siblings or my mum or my, partner or whoever it might be, they're really in this as well, right? That can be really eye-opening. And intimidating, I think.
Yes. Yeah.
Right.
Yeah.
Another thing that I really like to do, and a supervisor of mine used this intervention and I love it. It's called the 3 Ps assignment. And the 3 Ps stand for: what does your eating disorder protect you from? What does it provide you with? And then what does it prevent you from? And I think the protect and provide gives us an ability to explore the function of the eating disorder. And that's kind of something you would do in the therapy as part of the therapy process. But what does it prevent you from? Like you said, that there's this kind of dissociation or disconnection or even romanticizing, right? There's not really, it's not that bad, or I'm not that sick, or it's not really causing that much, challenge in my life. But when you think about what does it prevent me from, what's important to me and what does it prevent me from, that's going to give you the motivation that you need in treatment, right? Is it that I'm a mom and I really feel I'm not able to really connect and engage with my kids, or I want to set an example for them in terms of how they view their bodies or how their relationship with food is. There's so many things that it can prevent you from that aren't always in your conscious awareness at the beginning.
Yeah. And for people, you were mentioning about the function of bulimia or for an eating disorder. So what does that mean to you? How do you work with people?
In terms of the function of the eating disorder, I think it can be, it's different for everybody. So exploring that, I think that there's a notion, or a lot of my clients, especially as we start to kind of practice the more behavioral parts of like interrupting behaviors, how do we ride out urges? How do we ride the wave out when distress comes, right? And this idea that we're taking away something that, even though unhealthy, provided something for you, right? That it helped you cope with something. And it's not sustainable, right? Because it doesn't lead you to a place that's healthy, and it's not a healthy behavior. But we don't want to just take that away and then, okay, hold your breath and now just get through it. Just don't do that thing and just get through it. That's not going to be helpful. It's not going to be
You've got to replace it, haven't you?
Right, replacing it with something that is more adaptive. And I think that being able to understand what you're needing, whether it's the feelings, whether it's a trauma response, desire for control, how do I ride that distress out in a way that is healthy for me? And that's things like you were talking about with your book, with managing anxiety, or, working through trauma, or being able to kind of regulate your emotions and, ride some of those really strong urges out. You've got to replace it with something. And at the beginning, it doesn't always feel as effective as the eating disorder felt. And I think that that's a big piece of it too. It's like, well, why would I do this? It doesn't work as well. And that works. It's immediate, right? It's gone. That distress is gone. And so I often tell people, hey, it's practice. You've got to keep practicing. It's not going to feel that way at the beginning. But I do think it's an important part of the process, is like being able to understand that it served a function in your life at some point. And now, what was that function, and kind of exploring that with the patient.
Absolutely. And find other ways to be able to deal with those difficult, negative functions. So what brought you down the pathway of deciding that you were going to take this route of working with people with eating disorders?
I fell into it. I was really lucky to find, a passion that pretty early in my career. I had experience with eating disorders in terms of like practicums and trainings and things like that. And then my first kind of real dive into eating disorders was my first job out of graduate school. I worked at a treatment center, the inpatient level, and it was a really eye-opening experience. And I really, really loved being able to support people who I really found I had a lot of similarities with. I think that folks who struggle with eating disorders have a lot of these phenomenal qualities, right? This like desire for or drive, I guess, and wanting to meet goals, and intelligent, right? And I think that there was something about being a part of a treatment team too, and being in collaboration with the patient in helping them work on it, that was similar to me in terms of the relationships I developed in sports as well, right? Like we're all kind of working together to be able to kind of get to this goal. And so, yeah, I just had such a fantastic experience working inpatient and being able to see, I mean, the inpatient unit, you're working with folks who are really at the height of their eating disorders and the height of their distress. And so to be able to work with someone and see, you know, how much they were struggling at the beginning and at the admission, and then, you know, a couple months later or whatever it might have been, to see them walk out as they step down in care as a completely different person and feeling more empowered and more like themselves. It was just so rewarding for me, and that was it for me. I was done.
Yeah, absolutely. I mean, for me, the reason that I have gone down this route is because of having an eating disorder myself for 15 years, and being able to help somebody that just even being able to help somebody is just so huge to see that change for both of us, really.
Yeah, it's incredible
because it's such a dark time when you're buried in your eating disorder, and to see small little tiny steps of people just beginning to open up and change it's just phenomenal.
Yeah, I mean, I feel so privileged. I've worked in many different levels of care, and the inpatient is where I started, and right now I'm in private practice working with outpatient folks, and some of them I've been working with for quite some time. And you know, it's so rewarding over time to see where someone started and then the things that they have achieved, right? Whether it's, and things you've known from the beginning that they've always wanted, right? Whether it's a relationship or a deep connection or education, or, you know, reconnecting with family members or partners, or, you know, to be able to have a front row seat to that process is such an honor for me, and it's such a value of mine to be able to connect with people that way. So I just think that I have the coolest job in the world.
Absolutely. Absolutely. We did speak briefly before about that pathway, that recovery pathway, and the challenges that come with that, the slip-ups or relapses, because they are all part of the journey, aren't they?
Yeah, I think that, I mean, the saying is, and what I remind my patients is, recovery is not linear. And I think because a lot of folks have that that drive, that perfectionistic quality, that they want to do it right, and they want to make sure that, you know, especially when they're in a rhythm of, you know, I'm feeling really good, I'm interrupting behaviors, and then, you know, a stressful life event happens, or COVID happens, or, you know, or anything, right? It doesn't even have to be, you know, a huge event like COVID, that, you know, slip ups happen, and that is part of the process. And I really try to remind people of that, because it ebbs and flows. And, you know, each time you have a setback like that, you get practice and you get more information about what happened, right?
Absolutely, you can learn from it. Yeah.
Right. And then you take it with you into the next stage of your treatment and recovery, right? And so it's I know a lot of people will often say things like, you know, I just feel like I hadn't done this for X amount of years or months or whatever, and now I'm just back at the start again. And I really try to remind them that you're no way back at the start, right? That you're just going to take this piece of information and use it to keep going forward. But I know that can be a lot of shame and frustration, and it can be discouraging too. But yeah, that it is a normal part of that process. It's expected.
Yeah, it's expected. Absolutely. And people need to hear that. That's really important. Now, the other thing that we were talking about just briefly before is about having you have a teenager, a female teenager.
Yes.
And we just touched on it briefly, and I think it would be good for us to talk about that, because what advice would you give if say somebody had a teenager that was struggling with their eating patterns?
Yeah.
Or not even a teenager, they start very, very young now.
Yeah, it is starting very young. I think advice to parents that I would give is similar to what, we were talking a little bit about at the beginning of how to take that first step, is just start to get some more information about it, and start to observe your responses to it, right? What comes up for us when our kids start to struggle in that way, or their bodies start to change, or they're going through puberty, or what, and what are we doing? What are we modeling, I guess? And I don't, being a parent is very, very hard. It's very challenging. I have 3 girls, and I'm even in this field constantly aware of, okay, however I present, that's what they're consuming. That's the backdrop of
Yeah,
kind of,
absolutely, absolutely. And I think that's so important for people to hear, for parents to hear, or, even people in the future if they have children, is that, you've got to be really careful about how you talk about, what you're eating, your body,
yeah,
all sorts around your children, because they're just
right.
sponges and they'll just soak it up.
Right. And it's very covert, right? It's very subtle, like things, little comments that you might not even remember you said, right? That it's creating an attitude and a belief system towards food and body. Morality around food, like saying things like, I was so bad for eating that, or that was naughty that I ate that, or I was good today because I ate A, B, and C, right? Or I worked out. That's such a normalized comment in our society, but the impact of that comment over time, it creates a belief system, and kids assign it to them. And that's not to, assign blame to parents. Parenting is a hard enough job as it is, right?
Yeah.
But how can we be more mindful when we do make comments like that, right? And then how do we kind of add in those protective factors of what other things are we doing? Are we praising our kids for their bodies and their abilities, or are we praising them for more intrinsic internal qualities, right? How can we shift our language to support them in that way?
Yeah. Yeah, absolutely. And so if somebody had, a teenager that was struggling with their eating patterns, so what else would you say to them? What else would you say to the parents? So being aware of their language, and how they're, talking to their child or about themselves.
Right. I mean, I think comments about body are never specifically, never helpful, right? That we don't need to comment about our kids' bodies, right? If your kiddo is saying, I feel X, Y, and Z in a negative way about their body, you can explore that with them. Don't be afraid to open that up. Like, where is that coming from? Why do you feel that way? I think the tendency for a lot of parents and people is to want to take pain away from their kids, right? So it might be, we'll do it together. We'll go on more walks. To start focusing on weight loss as the solution. I think that's a very, very kind of slippery slope, and it's not ultimately helpful. Maybe kind of focusing a little bit more on health promoting behaviors, like, well, what can we do together to help you feel better, right? Like, can we play a game? Can we connect more? Do you want to hang out with your friends, right? To be able to kind of support your child without assigning that as the issue, right? Because the weight is not the issue, or the changes are not the issue. So that would be one way that I would kind of suggest folks do it, and also being mindful of how they're speaking about it. But I also think to observe your kiddo, right? That it can be one of those periods of time that, are high risk for development of eating disorders. And so making sure they're eating consistently, making sure that they feel like they have freedom with food and access to food, and talk about kind of nutritious meals rather than healthy and not healthy, right? You want to eat something nutritious. And I think too, a lot of parents say, but all my kids eat is junk, or they eat, quote unquote junk. To be able to say, okay, we don't need to eliminate foods. If you want them to, have, more nutritious foods, let's add foods rather than take away foods. I think that that's a good place to start around meals, and getting support from a dietitian or someone who has that expertise in nutrition counseling.
Yeah, that's an excellent idea. And it's hopping online and just beginning to, to find information to be able to help you. And it's starting to have that knowledge of, of how you're going to take this forward.
Right.
And how to approach that loved one. If you do think that they have an eating disorder, I know my poor mother, I put her through a very difficult time. I was in denial for a very long time.
Right.
Yeah, but it was because of her, and her, every once in a while she would approach me about my bulimia because I would hide it or try and hide it, but it was too obvious. And even though I would have none of it, she was gradually setting the seed to the point of me one day saying, okay, let's go to the doctor.
Right.
So even though, if you've got a loved one that has an eating disorder, but even though, you may be rejected at that particular point, it's kind of like setting a seed. And,
right.
And slowly over time, that seed will sink in.
That makes a lot of sense, right? You're not going to go in immediately with that, right? That might create some defensiveness and some withdrawal, right? But to be creating this opening and this space that you might not want to talk about it now, you might slam the door in my face now, but I'm going to keep at it and keep checking on you and keep giving you the space so that when you're ready and, when it's necessary, you're able to kind of, lean into that decision.
Yeah, and at that point, before that, it's a really good idea just to start to open up and get some knowledge behind you, and some different avenues about how you could take it forward. Yeah. Oh gosh, so Megan, thank you so much for joining us. So now, how can people find you?
Probably the best way to find me is through my website. It is acaciahealing.com, or my Instagram, Dr. Megan Wilhite. That's I'm trying to do better, to have a better social media presence, and that's my goal. I'm really going to push myself. It's not easy for me, so I'm really going to challenge myself this year to do a little bit more work on social media. Social media could use a little bit more positive diet.
Oh my God.
Less place.
Oh, absolutely. Absolutely. I think the world would welcome your knowledge on Instagram or wherever. Oh, excellent. Well, so do you work virtually as well?
I do. I am licensed in the state of Colorado. I see folks virtually and in person in Colorado. And then I'm also licensed in California, and I see folks virtually in California. And I work with kids and adolescents, families, and adults. So we work with the whole kind of anyone in that system, anyone who's struggling with an eating disorder or a loved one.
Wow. Oh, Megan, thank you so much for joining us and sharing your wealth of knowledge.
Thank you so much for having me. I really enjoyed it.
Yeah, thank you, Megan. So that's all for today's episode of Bulimia Sucks. So thank you to everybody for listening. And before we go, make sure you subscribe to the podcast on Apple iTunes or Stitcher or Google Podcasts or wherever you may listen. And then make sure you show some love for your favorite podcast by leaving us a review. So thank you for listening, and I look forward to chatting with you in the next episode.